Vaginal discharge is fluid released by glands in the vagina and cervix. The fluid carries dead cells and bacteria out of the body, and vaginal discharge helps keep the vagina clean and prevent infection. Burris also says normal vaginal discharge varies in amount and ranges in color from clear to milky, white discharge. Discharge may have a slight odor as well, although a foul, fishy odor is a sign of an infection. Immediately after a period, there is almost no discharge. 2 to 3 days after the period ends, there is a thick, white discharge. A few days later, the consistency changes to appear more like mucus. Before ovulation, the discharge becomes clear and sticky, and before the next period, discharge is thick and white in consistency. Vaginal discharge during pregnancy is thin, white, milky and mild smelling. The amount of discharge also increases during pregnancy. However, during perimenopause and menopause, discharge decreases due to low levels of estrogen. The following can cause estrogen levels to drop, leading to little to no vaginal discharge. 1. Medicines or hormones used in the treatment of breast cancer, endometriosis, fibroids or infertility. 2. Surgery to remove the ovaries. 3. Radiation treatment to the pelvic area. 4. Chemotherapy. 5. Severe stress, depression or intense exercise. Vaginal discharge color meaning thick, white discharge. If thick, white discharge goes along with other symptoms, such as itching, burning and irritation, it is probably due to a yeast infection. If not, it is normal discharge. You may also notice an increase in thick, white discharge before and after your period. Yellow discharge. Yellow discharge is abnormal discharge, as this is a sign of a bacterial infection or sexually transmitted infection. There also may be an odor associated with it. Brown discharge. Brown discharge may be caused by irregular period cycles. If brown discharge keeps appearing, a patient should schedule an appointment with a provider to be evaluated. This could be a sign of uterine or cervical cancer. Additionally, during menopause, a woman should not have any type of vaginal bleeding, which is also a sign of uterine cancer. Green discharge. Having green discharge is not normal. This is a sign of bacterial infection or a sexually transmitted infection, such as Trichomoniasis. Anyone experiencing green discharge should see her provider. If you are diagnosed with Trichomoniasis, you'll be placed on antibiotics. Yeast infection discharge. Yeast infection discharge is caused by an overgrowth of fungus in the vagina. Symptoms of yeast infection discharge include a thick, white, cottage cheese-like discharge, along with itching, redness, irritation and burning. Roughly 90% of women will have a yeast infection at some point in their life. Yeast infections are not contagious, and over-the-counter antifungal creams are available for a patient to use. But, if symptoms don't improve with treatment or she has more than 4 yeast infections in a year, she should see her provider. Bacterial vaginosis. Bacterial vaginosis is a common bacterial infection. It causes increased vaginal discharge that has a strong, foul, and sometimes fishy odor. Discharge may also look gray, thin, and watery. In some cases, the infection produces no symptoms. Although bacterial vaginosis isn't transmitted via sexual contact, you have a higher risk of developing it if you're sexually active or have recently gotten a new sexual partner. The infection can also put you at a higher risk of contracting a sexually transmitted infection, STI. Trichomoniasis. Trichomoniasis is another type of infection caused by a parasite. It's usually spread by sexual contact, but can also be contracted by sharing towels or bathing suits. Up to half of the people affected have no symptoms. Those who do will often notice a yellow, green, or frothy discharge with an unpleasant odor. Pain, inflammation, and itching around the vagina as well as when urinating or having sex are also common signs. Yeast infection. A yeast infection occurs when yeast growth increases in the vagina. It produces a thick and white discharge that looks similar to cottage cheese. This discharge doesn't usually smell. Other symptoms include burning, itching, and other irritation around the vagina along with soreness during sex or when urinating. The following can increase your likelihood of yeast infections. 1. Stress. 2. Diabetes. 3. Use of birth control pills. 4. Pregnancy. 5. Antibiotics, especially prolonged use over 10 days. Gonorrhea and chlamydia. Gonorrhea and chlamydia are STIs that can produce an abnormal discharge due to infecting the cervix. It's often yellow, greenish, or cloudy in color. You may also experience 1. Pain when urinating. 2. Stomach pain. 3. Bleeding after penetrative vaginal sex. 4. Bleeding between periods, but some people may have zero symptoms. Genital herpes. This STI can lead to thick vaginal discharge with a strong smell, particularly after sex. Sores and blisters can appear. Trusted source around the genitals along with bleeding between periods and a burning sensation when urinating. However, it's more common trusted source to have no or mild symptoms. If symptoms do occur, you may experience repeated outbreaks throughout your life. Pelvic inflammatory disease. Heavy, foul-smelling discharge and pain in the stomach, after sex, or while menstruating or urinating may be signs of pelvic inflammatory disease. This occurs when bacteria move into the vagina and up to other reproductive organs and can be caused by STIs that are left untreated like chlamydia or gonorrhea. Human papillomavirus or cervical cancer. The human papillomavirus infection is spread by sexual contact and can lead to cervical cancer. While there may be no symptoms, this type of cancer can result in 1. Bloody, brown, or watery discharge with an unpleasant odor. 2. Unusual bleeding occurring between periods or after sex. 3. Pain while urinating or an increased urge to urinate. In rare cases, brown or bloody discharge can also be a sign of endometrial cancer, fibroids, or other growths.